Thank you for having us and giving us the opportunity to share about the remote area medical clinics and the social works program involvement. We're going to start off. I have a partner with me today, Dr. Bethany Womack, and she's going to begin the presentation. But I really appreciate Bethany when I have a sign-up sheet for faculty support for our events at the RAM Clinic. Bethany always picks the 6 a.m. slots, and I am so grateful to her, and I'm sure the rest of the faculty are as well. So I'm going to turn it over to Dr. Womack. And have you given me the ability to share the screen?
Yes, you should be able to.
Okay. Okay, can everyone see? Okay. Okay, Dr. Womack, I've got 3 screens going here, so.
Well, thank you all for having us. I will just start off by saying that the RAM Clinic is something that has been, it serves some dual purposes. We're of course really honored to have the opportunity to participate in bringing care to people who might not otherwise have it as social workers, but it also provides a chance for our faculty and our students to reflect upon the role that these kinds of services play and what some of the social issues are that relate to the reason that these services are needed. So the RAM clinics were founded by a man named Stan Brock. He was from England, and he settled in the Knoxville area as an adult. So someone with kind of a Western perspective on health and well-being. And many medical mission groups, and including the early iterations of RAM, were conceived around this idea of bringing medical care to places in poor countries and geographically isolated regions. And so when we think about places that are isolated, we think about the isolation as the cause for the impoverishment and the fact that people there might be underserved by healthcare professionals because they're just so remote. And so we automatically start to think about isolated meaning somewhere else. But here at home and in the United States, people can be isolated from healthcare just due to the policies that we have surrounding insurance and care. And so the chart on the right shows some national statistics from the National Health Interview Survey that was done in 2019, that they found 31.2 million adults between 18 and 65 are uninsured. So over 10% of American adults don't have access to health insurance. And the chart is telling us that the number one reason by far that these adults say is why they don't have it is that it's not affordable for them. And so when we think about people who are economically isolated from healthcare, we can think about this means you don't always have the opportunity to build those supportive and trusting relationships with an ongoing provider. And so if you're getting services, you might be getting services at a time of crisis. And so the relationship that you have with your healthcare providers isn't necessarily going to be one that's ongoing. It's not going to be one that's trust-based necessarily. It's going to be something that's kind of crisis-based and in the moment. And so one of the things that we have found when we're working with folks at the RAM Clinic and that we share with our students is that the individuals who are attending the RAM clinics have often encountered healthcare and it's been a really negative experience. So things like smiles and pleasant greetings and extending thanks for coming to the clinic, thank you for taking care of your health today, is really important to people. Locally, over 13% of Hamilton County residents are living in poverty. In Chattanooga in the city, that figure rises to about 17%. And over 32,000 Hamilton County residents are uninsured. And most of that 32,000 people are working adults. They're just working very low income jobs or jobs that don't give them health insurance. And the unemployment rate, just to point out, in Hamilton County is actually pretty low. It tends to be lower than the national average. So we do have a lot of adults working. It's just that the work that they have isn't reaching everybody in terms of access to healthcare and consistent healthcare. Nationally, which the chart on the right represents national statistics from that same survey, Hispanic adults are much more likely to be uninsured. And that is also true in Hamilton County. In Hamilton County, 5% of our population is Hispanic. and 26% of Hispanic residents are uninsured. And that is also the group that is experiencing the highest rate of poverty among any race or ethnic groups in this county. And so another opportunity that the RAM Clinic kind of brings to the front of our students' minds when they're thinking about opportunities to improve culturally inclusive care is this reflection from one of our MSW students. She said, "I know we had several Spanish-speaking families come to our referral table after their medical care. I was pleased that they had been notified about the event, glad that they came to take advantage of our services. I just hoped there were enough Spanish-speaking clinic workers to ensure they were getting clear and complete information." I did not directly engage with these families myself, but I seem to remember my cohort members either struggling to communicate with them or having to search for a translator. And I hope clinic organizers take into consideration the variety of dialects and cultural differences between the various Latino countries. Just having someone on hand to speak Spanish may not be enough to communicate in culturally appropriate ways.
In the 80s, Stan Brock, after settling in Knoxville, sold everything that he had to begin remote area medical. He lived in a school that he operated remote area medical from, and he paid $1 to Knox County to rent the old school. Previously, while living with the Wapashanas in Guyana, he had experienced an accident in a region of the world that required a 28-day walk through very rough mountainous terrain in order to reach medical care. You couldn't ride a horse, you couldn't ride a vehicle. The only way to get there was to walk. After this experience, he was a pilot, and he began personally flying his own plane to carry medical care to people in the country. In the 90s, he realized that one of the richest nations in the world had regions that were remote, but due to circumstances that made access to medical care only a dream, and it wasn't the physical distance. He began operating his first pop-up clinic with a dental chair in the back of his pickup truck. Today, Remote Area Medical provides to the community host groups that organize the circumstances for the clinic. He provides planes filled, Remote Area Medical provides planes filled with supplies, semis with 100 portable dental chairs and equipment, vision exam stations and medical equipment, and a bus designed to produce eyeglasses in under an hour. Pop-up clinics extend for 1 to 3 days. Over the past 5 years, RAM has served 239,227 individuals, has provided 71.46 million in free care with the assistance of 68,831 volunteers. I thought you might find this video interesting, but it takes RAM has trained, paid employees and staff and volunteer staff that accompany this caravan of hope to clinic sites. With the help of many strong and nimble, as you can see here, volunteers, within 24 hours, they will unload the trucks, prepare and operationalize dental, medical, and vision care facilities and services for hundreds to thousands of uninsured and underserved individuals. And here's how a portable dental chair becomes a portable dental chair. They have to create and prepare around 100 of those for every clinic. RAM USA is comprised of their headquarters are now in Rockford, Tennessee. They have managed to purchase an old, a very good condition, but no longer used manufacturing site. And they have employed staff that manage operations, financials, public relations, and maintain all the supplies and equipment with some skilled volunteer assistants. The core volunteer group are core staff that are highly trained, and they supervise the individual clinics, and they get their travel expenses paid by RAM USA, but their time is not reimbursed. Then there's the host group. And we have the Hamilton County Host Group in this area that provides a pop-up clinic every 2 years. The last one was last fall. Here are the members of the host group committee. The host group has to recruit volunteer practicing dentists and hygienists, doctors, nurses, and supervised interns. Some of their expenses are covered. Then there are volunteers that unload the trucks, put up the tents, build the, put together the dental chairs, set up all the clinics. And these volunteers register through the RAM system, and they simply show up at the next RAM clinic, help set it up, and then they come back on Sunday and they disassemble it. We are very fortunate to also have the unwavering assistance of the East Ridge Middle School ROTC, who show up every year to help unload the trucks and disassemble the clinics. In Hamilton County, Tennessee, the RAM host group was started by a gentleman by the name of Bob Neville. He was watching television one night, came across a segment of 60 Minutes where they were profiling Stan Brock, and that attracted him to volunteer with the RAM clinics. He decided that he needed to start a host group here in the area so that the Hamilton County area could have a RAM clinic. He's been involved with RAM clinics for 20 years. And after observing 5 to 7 clinics, he recruited a host committee. We meet regularly. We begin meeting 1 year prior to an actual clinic, and we remain in contact between clinics constantly. When we identify something that we need or use, we're constantly exchanging information, recruiting partners, etc. We have to raise the funds, secure sponsors, secure in-kind donations, identify a site. And thanks to the city of East Ridge, they donate our site every year. We have to manage the publicity, recruit the practitioners, be present for the clinic assembly, recruit security, and thanks to the Tennessee National Guard, arrange food services for over 300 volunteers, provide housing for the practitioners and food for volunteers, provide site security, and provide comfort measures for those waiting in the parking lot in the form of portable toilets, blankets, snacks, and security. We have, we consider our clinic 34,000 square feet of hope. We have one of the nicer facilities for RAM clinics in the form of the Camp Jordan Arena. It is air conditioned and heated and dry. So many of the RAM clinics occur in fairgrounds under tents, and if it rains, it rains. They will occur in school gyms, in churches, in small community airports. They have one that occurs up at the Raceway up in, I believe it's Bristol, Tennessee. Anywhere that they can find the space to provide a RAM clinic. But we have a very nice facility. The use is donated by the city of East Ridge. And it is 34,000 square feet. This is the inside of the clinic on November the 19th. As you can see, the dental stations are set up and ready to go. But October 21st, a major change had occurred in the provision of healthcare, and we had to obtain and use RAM obtained and uses an air exchange system, and each dental chair is now in its own tent that is sterilized in between uses. Once they're sterilized, they have to remain unused for 20 minutes because they also receive the fog treatments for sterilization as well as hands-on cleaning. The RAM mission is to prevent pain and alleviate suffering by providing free quality health care to those in need. The vision is to be the best at operating clinics, which enhance the quality of life through delivery of competent and compassionate healthcare services to those who are impoverished, isolated, and underserved. And remote area medical is not aligned with any political or religious agendas or agencies. The qualifications for services are very, very simple. Questions about insurance, citizenship, employment, ethnicity are never asked. Cards of any type are not required. The only question asked is, where does it hurt? What do you need? And a brief health history will be obtained in order to support quality care. This is in 2019, Dr. Mark Stoutenberg, who was over the MPH program here at UTC, was working with the RAM host group and said, what about social services? And he reached out to the UTC social work program and invited us to join the RAM clinic. It most definitely engaged students and expanded their perspectives about poverty, individuals being underserved, and the reasons why. And this is some of our group where we took a break in between our responsibilities. The Master of Public Health program in 2019 provided education sessions for the participants while they were waiting for their appointments. In 2021, they served as clinic guides and conducted exit surveys because participants had to wait in their cars. They could no longer wait in groups because of COVID. We were the very first RAM clinic ever that had an embedded social work services function. We had 15 bachelor's and master's students that provided together 73 direct service hours, 6 faculty that provided 47 direct service hours, and together it was 120 service hours, and that doesn't count the training and preparation that the group goes through, and that brought it up to about 160 service hours. Here is the group. This is the 2021 group. You notice we've changed t-shirt color. That's because gold was not available. We couldn't get the gold t-shirts, so we changed to green. The green t-shirts are to help people identify who we are so that they can reach out to us quickly. And the cloths on the table aren't there for decoration. They're there to help with the language barriers and so that you can say, go to the bright colored table or the yellow and blue table, and that helped a lot. Students quickly engaged into the event. Students were signed up and then were trained for the event and really seemed to benefit from the opportunity to have the immersion experience in serving the clients of RAM. Besides modeling from those around them, students gain experience managing face-to-face interactions with clients, applying interview skills, critical thinking skills, and as they work shoulder to shoulder to expand hope for the participants and to expand it beyond the walls of the arena. They help patients develop insight and knowledge in the areas of navigating medical services, effective utilization of resources, and they came seeking hope for the day, and we hope that we gave them hope for the future. Dr. Womack, I think, let's see. Here is a list of all the skills that the students were able to use and the benefits to the participants. Dr. Womack.
Yeah, okay. So this is information that the RAM clinic here in Hamilton County has put together about the number of people that have come to each of the clinics that have been held over the past decade or so. This data goes back to 2012. And so you can see that over 4,000 patients have been seen in the past decade and have gotten multiple services. Dental, you can see, is like the #1 service that's provided. And I think that has a lot to do with the fact that only emergency dental care is covered in Tennessee. That may be changing with some of the upcoming changes to the TennCare program, but dental is a high need for a lot of the folks who come to RAM. They're also able to get exams for eyeglasses and some general medical services. And the types of things that the social workers are helping patients with is if they need follow-up care. So a lot of folks, for instance, will have their eye exam and they might say, well, you know, it looks like you've got a cataract, or it looks like you might have glaucoma and you need to be seen by another specialist after they leave RAM. So trying to find resources where they can go get that follow-up care is what the post-clinic referrals are there to help with. Yeah, and the value of these services, what you can see here, just from the social work services data, the first year that we were out, we saw 160 of the 933 people that had come to the RAM clinic. And we saw a greater percentage of that. We saw almost a third of the people the second year we were there. And that seems to be due to the fact that a number of people needed some help with some economic resources. Their practitioners would ask, where does it hurt? What do you need? And some people would say food. Some people would say their housing was an issue. So we were there to address that as well. And let's see, is there one more data slide? It may have been on the, yeah. Let's go to this.
Okay. The students found a lot of value in the experience. It's immeasurable for students, faculty, and community social workers. In 2019, the services were provided by our students and supervised by faculty. In 2021, an invitation was extended to community social workers to come and join us. And we had one person who was able to come on those dates. So far, I now have 4 community social workers who are going to come and join us in 2023. An additional resource that was very helpful for us in 2021 includes the availability of the United Way Community Resource Database and the Care Connector that has been developed by the nursing program. We were able to do so much more and meet so many additional resources of the participants because we had access to services at our fingertips. And one student was observed assisting a patient. It was complimented by a faculty member on her highly effective professional client interaction and her service provision. And she responded to the compliment by saying, "Thank you. I watched you." And the event, the modeling, the demonstration of social work skills was very powerful to the students who were present. Stan Brock was very much aware that a lot of policies and other issues that are causing the barriers to healthcare needed to be addressed. And in order to make the RAM clinic successful, he was instrumental in persuading Tennessee legislators to let licensed healthcare professionals from out of state volunteer to provide free medical services. For the 2 years that I've been involved in the clinic, and I understand for many years prior to that, University of Buffalo in New York, their dental students come down and serve in the clinic. We've had students from Meharry, we've had students from California, and that's because of his advocacy in the partly because of his advocacy in the legislature to allow that to happen. RAM also is trying to help deal with disparities. RAM in 2020 expanded services to include telehealth. If you have anyone that might be able to take advantage of these services, you go to ramusa.org and just follow the prompts to the page that has the telehealth clinic schedule and follow the directions, and someone can, schedule a telehealth appointment for themselves. One of the barriers to this service might be their access to technology, and there are computers available at the libraries for individuals to use. One of the barriers to using the RAM clinic is transportation. We're located in East Ridge, and Carta bus service does not go to East Ridge. And so the individual has to locate transportation. And having heard many patients' stories, some of them are very, very creative in arriving to our clinics. Dr. Wama?
A final reflection, yeah. The final reflection from one of our students was saying essentially the amount of people who had come from miles away to get treatment, especially dental work, was an eye-opener. People were just glad to get many or even all of their teeth pulled out for free. The whole scene was like something I would expect to see in a third world country, yet here we are in America. And so one of the sayings that Stan Brock said is that there are Wapashanas everywhere. It's not just in these isolated parts of the world somewhere else where people need access to healthcare and access to meaningful care.
Mr. Brock was asked in an interview about his legacy, and he said, "I hope that 100 years from now, no one will remember me at all because this will be a thing of the past." I'm just the voice of the homeless and the underserved, he said. But unless they fix these basic things, we're going to be doing this long after my lifetime. He left us in April of 2018. And his mantra wherever he went was never forget the mission. Here are some sources and links if you want to know more information about remote area medical clinics. There's an introduction on YouTube. There's a virtual tour of remote area medical headquarters. This is a wonderful video about toothless and uninsured in Virginia. It gives you tremendous insight into the patients we serve, as well as insight into a clinic that is created from tents and a very small rural airport out in the middle of the field, and it had rained. Also, there is a video about healthcare reform in Roane County and RAM's involvement. There is a Facebook page about RAM USA, and there is also a book written by Stan Brock, or about Stan Brock, called The Medicine Man. You can go to ramusa.org, which is the organization's webpage. If you want to volunteer, you can go to ramusa.org and click on the prompts and find the link. And there is his obituary was written by Sam Roberts in the New York Times, and it's a fascinating story. And if you want to know more about the people that RAM and all of us try to serve, I have a book that I use in one of my social work classes that introduces students to the working poor. It is a surprising, eye-opening book that provides some really good material for some very interesting discussions in class. And it's by David K. Shipler, called The Working Poor, Invisible in America. We thank you. And if you have any questions, my email is mary-b-andrews@utc.edu. Do you have any questions of us?
Thank you for that presentation and the information. That's really good. I also put in chat the www.ramusa.org. If like I said, folks are cutting and pasting from the chat into a Word document, there is that. I just want to ask a question, kind of question/comment, because when you and I were talking, and I know RAM clinics start really early. And so you mentioned that Dr. Womack would sign up for the 6 o'clock spot. Tell us what time patients actually start coming and lining up for a RAM clinic.
1 to 2 days prior to the clinic. And what is fortunate about our location is you saw all the parking space that we have. The host clinic, part of the funds that we raise goes to provide portable toilets, snacks, blankets if it's cold, a lot of comfort measures for those who are waiting. We have individuals who rely on RAM clinics for their medical care, and they will follow the clinic schedule on the RAM website, and they will drive to wherever they need to go to get their medical exams, their dental services, or their vision care. The next clinic is going to be at Camp Jordan, is going to be in September of 23. And I can't remember the exact dates, but it's the weekend after Labor Day. There's going to be a clinic this year in November up in Cleveland at, I believe, St. Therese Catholic Church, and it will be there for 2 days. I do not know how large that clinic is. And Dayton also hosts a clinic, but I don't know the dates.
Okay, and so that would still be go to the ramusa.org.
Go to ramusa.org and find that information there. They post a schedule.
Okay, I do have a question in the chat. It says, what role do NPs have if they volunteer at the clinic? So
I'm sorry, say that again.
So what role do nurse practitioners have if they volunteer at the clinic?
Nurse practitioners they help with triage. When someone is admitted into the arena, they are triaged by usually nurse practitioners to find out if they need medical, dental, or vision. And then they are the ones who will do the brief health assessment. Also, nurse practitioners are very much needed to provide medical services. We have a couple of physicians who work with us every year to supervise the services, but a lot of those medical services are provided by nurse practitioners. There are women who come every year to our clinic for the gynecological exam. They come for medical needs, etc. They come for aches and pains. We had a couple this past year that had to be sent to the hospital by ambulance because I think it was a blood clot or something they discovered. So, but yes, we have a separate room where medical services are provided, and there are people who literally depend upon us for that care.
And that is very true. And you said something at the beginning, which I have seen in practice, and others who've been out in practice have probably as well. By the time you mentioned with it, by the time they come to your clinic, they are really acutely, chronically ill. And a lot of times having that Appalachia background and that culture is you try everything else before you go see a medical provider, because as you said, there's that distrust of the medical community in general. How do you feel that, oh, okay, sorry, we're running 10 minutes behind. That's because there's such interesting stuff. So I'll tell you what, if we have time toward the end, maybe we'll circle back around. If you have questions, contact information was provided. If you don't mind sending me your information again, and I will post it in chat. So maybe if folks have more questions, since you're helping to do RAM clinics and have the information, we can.
Okay.
Folks can reach out.
I'd also
Thank you.
love to.
Thank you all for listening and having us.
Yeah.
Thank you.
Yeah.
I'd also love, there are a couple questions in the chat, and since we're running a little bit behind, maybe Mary and Dr. Womack, maybe you can answer some of those questions in the chat itself as well.
That'd be
that we
fine.
can see the answers.
Be glad to.
And hopefully have a little discussion at the end of the conference as well.
Mhm.
Thank you. That was
Yeah,
really enlightening. And we hope that maybe our UTC nurse practitioner program can be involved in the future.
That's what
Yes.
she and I were talking about. How to get us partnered in more. Absolutely.
That would be awesome.